Hello and welcome to the award-winning Waterman Wellness, your pathway to whole person health, body, mind, and spirit. I'm your host, Kristen Ludicky. We have plenty of healthful information featuring local experts, including the recommended age to have a colonoscopy screening has been lowered. Stay tuned for our local expert to explain why. This Umatilla woman was surprised to learn her orthopedic surgeon's plan for recovery after a total knee replacement. And this first grader's recent bout with the flu came with unexpected and painful symptoms. Her story is coming up. We begin this episode with a new resource to help patients who need additional care after a medical emergency. AdventHealth Waterman recently celebrated the opening of its new Inpatient Rehabilitation Center, the first of its kind in Lake County. The 12 private room facility is designed for patients who need at least 3 hours of therapy a day from different types of specialists. Previously, patients had to travel out of Lake County for the specialized treatment, which usually lasts for a couple of weeks.
The patients that come to inpatient rehab, they've had a major event. They've likely had a stroke or some other kind of event that's really changed their life and changed their family's life. And so keeping something where it's close to home, where family can continue to be there and be present, is essential to help them recover.
The unit offers the latest technology in rehabilitation, including a hydraulic car that adjusts to the exact height of a patient's personal car so they can practice getting in and out of the vehicle. Patients with limited arm and hand mobility can get specialized training with a state-of-the-art system. A 100-foot-long track system helps patients begin walking without the fear or risk of falling.
A big part about inpatient rehab is getting the patient back to their community and practicing the things that they did at home. And so we're able to do that with real live ADL kitchen, a practice kitchen that they can make meals and do things that they normally would do at home. We can also do that within our ADL suite, which is like an apartment. It has a washer, dryer, a bed, a regular kind of residential bathroom there that we can practice making the bed, doing laundry, etc., to really help that patient be ready for home.
The Inpatient Rehabilitation Center is on the 3rd floor of the hospital's new tower, which opened last year, and is part of an $85 million expansion project at AdventHealth Waterman. You can learn more about the rehabilitation services offered at the Tavares Hospital by visiting AdventHealthWaterman.com. We've all heard the saying, there's no place like home. But for some orthopedic patients, doctors say it's best to recover from a total knee replacement exactly where they feel most comfortable.
I had arthroscopic knee surgery before on the same knee about 3-4 years ago. After that, I played a lot of softball, I ran races, I hiked with my dogs a lot. I moved here December of 17. I noticed like a lot of pain in my knee. I just kind of brushed it off thinking it would go away. It didn't, to the point where I couldn't even drive. Like I couldn't sleep, I couldn't drive.
Mosh, who is a nurse, was referred to orthopedic surgeon Donald Perry. He determined that she needed a total knee replacement. Mosh agreed, but was surprised with his recovery plan for her.
Dr. Perry asked me, he goes, "Dawn, do you think you would be okay going home the same day?" And I said, "Sure." He said, "You'll be taken care of." You know, I had prescriptions beforehand, so I had a lot of, reassurance that I'd be okay. And he said he would call me the next day.
For a total knee replacement to be performed as an outpatient, the ideal candidate would be somebody probably 60 years or less, but have minimal past medical history. Most of the people are younger, still working, and have a good social support at home. Obviously, if you live by yourself, if you don't have anybody to help you out, but we look at the complete picture to determine who's the ideal candidate for having outpatient total knee arthroplasty.
After the surgery, Dr. Perry wanted Mosh to have home health care. She chose AdventHealth Waterman Home Care Services.
They were wonderful. I mean, they get in touch with you right away, ask you what is a good time to come, because they have to check your wounds. They have to, they do an extensive check. There was a lot of good communication there. And I also even text Dr. Perry a couple times. I have an implant. So, they tell you, you have to take care of it. It's a joint, and, if I run, if I do all that hard stuff on it, it's gonna wear it down. So the running and the softball I don't do, but walking, riding my bike, I still hike with my dogs.
You'll find information to help you alleviate joint pain by checking out the website on your screen. With this very active flu season, doctors urge everyone to get medical attention when symptoms appear. And they want you to watch out for secondary symptoms of the flu.
She woke up pretty early and said, "Mommy, I don't feel good." And you're a parent, you look at your kid and she had the circles under her eyes, she wasn't the right color, so got her in the car and I took her to Centricare. She tested positive for the flu.
Sent home to recover, Riley LaJeunesse seemed to get better until a couple of mornings later.
So I was in my bed and then I felt like I had to go to the restroom, and then as soon as my feet touched the floor, I noticed that it had a real bad pain.
I think any parent, when they wake up at 4 o'clock, 3:30 in the morning and hear their kids screaming for them at the top of their lungs and not the normal, I'm scared, or that's a terrible feeling. And it was just her legs. And I mean, the second we would touch her calf, she'd jump up. So I told my husband, get her in the car. I think, we got to go in.
Crystal LaJeunesse says the AdventHealth Waterman emergency team immediately recognized what was wrong.
They explained it was myositis and that it causes muscle breakdown in the legs and that, that's going to cause a lot of pain for her.
Basically what happens is the muscle enzymes, creatine kinase, goes high, and that's an enzyme that is broken down by the kidneys. And so we worry about that because sometimes the muscle enzyme load is too high for the kidney to bear. If it's caught early enough, which most of them are, because these kids will complain of extreme pain, it's usually not an issue because you start them on IV fluids to flush out the extra enzymes in the body so that it doesn't damage the kidneys.
Now recovered, Riley says she does have some good memories from her nearly week-long stay in the hospital.
They said I had to kind of move around to feel a little bit better. So then I came up with several different things to do.
We put on music and some of the nurses came by and one of them would dance with her for a few, minutes, and she winded pretty quick, but it was fun.
2 different doctors gave me 2 different kinds of popsicles. Welcome to the life.
You can find information about flu prevention and other related resources by visiting AdventHealthWaterman.com. It's time to take a short break, but when Waterman Wellness returns, you'll learn about advanced screening technology that's helping local specialists save lives. Lake County specialists are getting a better picture of their patients' health thanks to the state-of-the-art MRI machine. Stay tuned for more on this amazing machine. And you'll find out how this vitamin-sized camera can help identify potential intestinal diseases. Check out Waterman Wellness magazine for even more health and wellness information. You can arrange for home delivery of the magazine by visiting watermanwellness.com. Plus, you'll find a listing of the specialists featured in this episode. Here are some community events you and your loved ones might want to check out. Don't go away. Waterman Wellness will return shortly. Welcome back to the award-winning Waterman Wellness, your pathway to whole person health, body, mind, and spirit. I'm Kristen Luedeke. Doctors rely on medical screenings to help determine the best way to treat a disease or injury. Our next 2 stories highlight advanced technology that help Lake County specialists keep a closer eye on their patients' health. AdventHealth Waterman's interventional radiologist, Kevin Stewart, is excited about the hospital's new 3T MRI machine.
Yeah, one of the biggest things with this new machine is the 3T MRI machines give more signal, and so because it gives more signal, it gives better image quality for us. So the way to relate to that is, some of you had early digital cameras versus the cameras that we have now, and you see the difference in image quality. So as radiologists, we're looking at pictures and fine details in those pictures. We're trying to determine if cancers or other tumors are inside or outside specific organs, because it changes treatment for it. Or in orthopedics, if you have an injury to a specific small structure in a knee, a shoulder, those kind of things, if you don't have a lot of signal, you can't see the really fine details that make the correct diagnosis for patients. This one has what's called their biometric system on it. So basically it's taking into consideration your breathing. So it's timing all of your body movements with scans. And so basically all the holding your breath, keeping still, all that, it's helping compensate for that as well, just with the added technology that's on this specific scanner.
Mount Dora resident Evelyn Pichardo was referred to be screened on the 3T MRI. She admits she was very nervous about it, having had an MRI years ago.
Before, I feel very scared because the regular MRI is too close and I have claustrophobia. But the lady, she take care of me. She was very nice. She asked me, "You want to listen to some music?" And I say, "Yeah, that's better." They put in music, Christian music, for 45 minutes. So when they say you don't, yeah, oh, really? It's different, and another MRI I do it before because that one is open. It's nice. If I can do it again, I do it because I feel very comfortable.
That this is the best in this region, and so for them to get the best care by the best diagnostic tools available for them, and to be able to get the correct diagnosis, able to tailor treatment specifically to individuals, and then just a great experience as far as the imaging goes as well. And so it's a whole package, and just providing care for them. It's truly a blessing to the people in this area.
You can learn more about the advanced imaging technology at AdventHealth Waterman by visiting the website on your screen. Next, an AdventHealth Waterman gastroenterologist explains why guidelines for having a colonoscopy have changed recently. He says the procedure is the gold standard for helping prevent colorectal cancer.
The American Cancer Society has made a recommendation to lower the screening age for colonoscopy. It used to be 50 years old and above for an average risk patient. So 45 is now the new screening guideline for an average risk patient. This would exclude patients with higher risk conditions such as family history or genetic predisposition or other such reasons. They've decided to reduce the age of screening because we are now seeing an increasing incidence of colon cancer in patients that are at younger ages. Colonoscopy is the only modality that we have that we can actually do something at the time of the procedure. Other testing, such as stool-based testing or CT scans or other such modalities, will not allow us to actually take out a polyp, for example, cut out the polyp before it becomes a cancer. We have therefore theoretically reduced that patient's risk of developing colon cancer from that polyp in the future.
Mount Dora resident Larry Maselli chose Dr. Casalia to perform his recent colonoscopy. Maselli has a family history of colon cancer and was experiencing other issues that caused concern.
So I've always been very proactive, and I've had a testing done every 10 years. So this year was a milestone year for me. I turned 60 and it was time to get it checked. I also had a blood test come back with some indicators on it that said that I should get checked sooner rather than later.
Due to the blood test results and other symptoms, Dr. Casalia wanted to check Maselli's small intestine for possible other causes or diseases using a pill cam.
So the pill camera is essentially what the name is. It's a camera that's in a pill. So patients take this pill, they swallow it, and it goes through their small intestine. With this pill, we're able to see inflammation, ulcers, polyps, things that we would not be able to see with other testing.
You go in early in the morning at 8 o'clock. They get you outfitted with a few electrical monitors, and they put this little pack that's about the size of an old cassette player that we used to wear on your belt, and they give you a glass of water and say, swallow this pill. And they turn a little camera on, and you can see it as it starts to go down. And you come back the next morning and you hand all the paraphernalia in, and that's the extent of it.
It used to be thought that you can only get these types of advanced technology, these futuristic things at huge centers such as, Orlando, or even going to Mayo Clinic. We actually have this technology. We've had it for a while. It's another tool that we have here at Waterman that allows us to keep patients with us so that they don't have to have the inconvenience of waiting for another appointment, reestablishing themselves in another system, and we can actually provide the guidance and appropriate treatment to help them and help them right here.
The good news was they were all negative results, so that was worthwhile. And I have a friend whose very first colonoscopy gave him the unfortunate diagnosis of stage 3 colon cancer. There's no reason for that. It doesn't hurt. It's uncomfortable the evening before, but that's worth the knowledge that you don't have colon cancer. Most people find out when they haven't had it and they start to experience symptoms that it's very well advanced.
You can learn more about cancer screenings available here in Lake County by visiting AdventHealthCancerWaterman.com. We hope you've enjoyed this episode of Waterman Wellness, your pathway to whole person health, body, mind, and spirit. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Kristen Ludicky for the award-winning Waterman Wellness.